Thanks, Selmar. That was a very great talk and a good way to start off the session entitled Technology Development Pathways for Medical Nanobots, because I think you've kind of laid out, the sort of the interstate highway system, if you will, for the behavior of such nanobots. And thank you very much for that. Our next speaker is Dr. Tad Hogg, who's going to be speaking on the topic of coordinating microscopic robots for medical applications. Dr. Hogg holds physics degrees from both Caltech and Stanford and currently works in the Information Dynamics Laboratory at Hewlett-Packard. Dr. Hogg's research includes developing defect-tolerant systems architectures for molecular electronics. He's also experimentally testing e-commerce reputation mechanisms and economic benefits from limited forms of quantum information processing. Again, I think very much appropriate in our topic heading technology development pathways, because what Tad really is doing here is laying out sort of the permissible pathway parameters. So Tad, please join me up here at the podium. We look forward to your talk. Thank you.
Let's see, so where is the... Oh, here we are. Okay, thank you very much. I'd like to thank the organizers for inviting me here. It's going to be a pleasure addressing you, and I hope also to identify different areas of collaboration and possible further applications beyond what I'll be talking about today. So I'm going to be describing some work that's going on at HP to look at applications of fairly early developments in molecular electronics and computing. Most of the work at HP is trying to figure out how to build some of these devices. I'm here looking at, well, how might we make some use of them, at least in the fairly early versions of the technology. The outline of this talk, I'm going to talk briefly about microscopic robots. The poster that we have for this conference did a really good job of at least giving the general idea here, so I can go over that fairly briefly. And then I'm going to focus mainly on a couple of example tasks that combine some of this technology with a couple of medical applications. And these are chosen just really for illustration and because I happen to run into some people that were familiar with the medicine side of it. Not that these are necessarily the first or the best particular applications. And again, if you have other ideas during the next couple of days, please feel free to bring them up to me. So the idea of microscopic robots is basically machines of roughly the size of cells, say bacteria, about a micron in size, with a few basic capabilities, namely able to sense their environment. In this case, mainly it'll be chemical sensing, do a little bit of computing, probably simple pattern recognition kinds of applications, and then take some action. And that could be move around, release some chemicals, report on what's been found. And I'm very much interested in focusing on what are some plausible extrapolations of current developments in nanotechnology toward developing these sorts of capabilities. I'm also very much interested in looking at what a large number of these fairly simple devices can do, rather than a few or just one. The kinds of applications I'm thinking of will be many thousands to billions of devices, depending on the application. And we're really looking at what are some novel applications, particularly for medicine, from the actions of the entire group, rather than any single device. This kind of approach for robotics raises a number of system design challenges. How do you get reliable group behavior from devices like this when their physical environment is very different from what we're used to with larger robots? And I'll mention a little bit of that, in particular dealing with motion in fluids, chemical diffusion, Brownian motion, things that we normally don't have to think about for larger robots. The question I'm going to focus on, again, is not how we build these devices, which is a major challenge, a technical challenge, but rather how might we design controls for such robots. And as I mentioned, compared to conventional robotics, the physics of their environment is very different. we generally will be dealing with a much larger number of robots than we're used to in the larger scale systems. And we're also dealing with a wide variety of particular microenvironments, say within the body or within the environment, that's not very well characterized, at least at this point. And it's one of the things that these robots, in a sense, one of their first tasks can be to help us understand what are the environments that these robots will be operating in, so that then we can use that information to improve the programs. Let me just briefly describe some of the physics that's different about these robots, and then things also that we don't have to worry about. The major difference in physics is that surface is much more important than volume. Namely, that we're dealing with fluids, generally at low Reynolds number, if for those of you familiar with fluid. And that just means friction, surface tension are much more important than sort of bulk flows, mass, and inertia. There's a really nice article that Purcell wrote a number of years ago looking mainly at the behavior of bacteria, but it applies to these sorts of robots as well. It's called Life at Low Reynolds Number. It's a non-technical article, and it's just sort of a delightful physicist view of what it's like to be a bacteria moving around in fluids. A second general physical effect is that thermal noise is a noticeable but not a dominant factor for these devices. Again, it's something that's completely negligible for large-scale robots. And I just have the third point there, just because occasionally people ask me questions about this. These machines, about the size of cells, quantum effects are not important. Those would only come in if we're talking, say, the size of atoms and smaller. So that's not something we need to worry about. So now let me turn to some example applications. And the task scenarios I'm going to talk about here are first enhancing immune response to injury or infection. And the second one is using some of these devices to help repair damaged nerves. Both of these are just, again, as I mentioned, illustrations. They're not necessarily the only things that these devices could do or the best things to start with, but they do illustrate a number of the possibilities and difficulties. So the first task, in terms of responding to injury, we would like these devices to monitor for some particular kind of chemical signal, perhaps follow the gradient of this chemical to the source, maybe do something there, or at least just identify what it is. Also, perhaps pass whatever they find to an attending physician. This is something that our own immune system doesn't do very well. And so this could be something that these devices, even if they actually don't do anything in terms of addressing the infection, could be very useful just in diagnosing it very, very quickly and very specifically. The cartoon version here then is the physician is telling these little machines is, go in, look around, tell me what you found, and then I'll think about what it means and what to do about it. That's sort of the simplest kind of scenario. I'm not asking these robots to take actions, just go in and have a look around. So here, the kind of scenario is thinking of introducing these devices through the circulatory system, and that's nice because it lets them get near everything in the body, within a few cell diameters, typically. And we're talking about these devices being small enough to fit through even the smallest of our blood vessels, and so that lets them go everywhere. Take a look everywhere. This is kind of the sort of artist's schematic, and you've seen a much prettier picture on the conference poster here. But this is to give you some idea of the microenvironment for these machines. That is, it's very crowded. There's lots of the volume is about 20 to 40% taken up by the blood cells, and these machines being somewhat smaller but comparable in size to cells. We can look at a variety of particular control problems, and I'm just going to illustrate one particular one here, and that is, suppose we're asking these robots to detect some interesting chemical that's being released by one or a few cells and entering the blood vessel through the surface somewhere. By looking at the physical properties of these devices, we can try to compare what are some different possible control mechanisms and which ones might work better. So here is one possibility: is you go along, and when you detect whatever chemical it is you're programmed to look for. You say, gee, I ought to go follow the gradient back to the source and then figure out what's there. Certainly is one possibility. But this has a physical problem, or trade-off, if you like, that because of the way the chemicals diffuse into the fluid and are pushed downstream, most likely the device will only detect the chemical after it's gone past it a little bit, and then would have to swim upstream against the fluid flow to get to the source. So that is possible, but it requires a lot of power to go swim against the flow of the fluid. Another possibility is to use a cooperative approach where the first one goes by and detects something, but instead of it trying to get to the signal, to the source, it releases some signal, say an ultrasound pulse or message that some of the other robots a bit further upstream could hear about, and then say, hey, I ought to go near the wall of the vessel now because something is likely to be interesting. And you can compare the energetics of what it costs to communicate versus what it costs to swim in various speeds. And in this particular case, for typical flow rates in small blood vessels, you would benefit a lot in terms of the energy that you would need by doing a coordinated response like this, rather than trying to have one do it all by itself. So that's just one example of the kinds of trade-offs we might look at for coming up with what are the appropriate control programs for these devices. And let me just summarize what a couple of studies have found. If you're trying to use these devices basically for diagnostics, you can have fairly simple control rules, can be quite effective at looking for particular chemical patterns and so on. You get redundancy from huge numbers of devices. That is, by introducing a large number, at least a few are likely to go any particular place. And so even if the source is very tiny, you're likely to have at least a few of these devices in a reasonable time find it. And a corollary of that is you can generally get much faster response than what the immune system gives us, plus the ability to then communicate specifically what has been found. Let me turn now to my second example, which is looking at repairing injured nerves. Here, in general, there are two kinds of approaches that people look at. And one is try to figure out what sort of chemicals and signals do you need to introduce to the nerves to get them to regenerate. And that would be a perfectly reasonable approach. A second approach, and it's the one I'm going to focus on here, is to think about repairing damaged nerves with graft tissue. So here we're talking about a bit more complicated task for the robots, although generally it will be a smaller number. And here the idea is we want these devices to help us find exactly what the problem is. What's the damage, what's not damaged, and so on. Figure out what's going on, tell me about it, me being the physician or a big computer. Then outside, with all this information, I'll figure out what needs to be done, and then tell these devices specifically what to do. So I'm not requiring the devices themselves to be that clever. Rather, they're gathering information in a very limited way. You do a lot of the heavy-duty computation, as well as physician deciding whether it's appropriate or not outside, and then finally giving them very specific instructions of what to do. So the nervous system, similar to branching blood vessels, has a relatively fractal-like kind of structure with many hierarchical levels. And here's sort of a basic cartoon view of what happens during injury and why it would be useful to have a very rapid way of responding to injured nerves. So one of the things that happens is if an axon, say, is injured, that the downstream part of the cell eventually dies away, and then you lose whatever the particular synapses were. So even if you could then have some way of regenerating, you would essentially have to relearn where those synapses go and what their strength is and so on. So it would be nice, if possible, to have some kind of response acutely rather than when waiting a while, where before all this cell damage happens. And then consequent to that is the injured cell itself can die. So Dr. Stratovan, who's a researcher at USCF, UCSF, has been looking at MEM scale technology, and this is basically millimeter-sized machines, about 1,000 times larger than what I've been talking about, as a way to basically take graft tissue, remove a damaged section of nerve, and then basically reconnect the wiring, if you like. And he's demonstrated this at least on individual axons already. Now, one of the challenges is if you're going to use this in practice, you can't just connect just one or two axons. You need to connect typically thousands in the nerve to get functional behavior again. So, and here's a bottom view of the MEM scale device that he's looked at. This is about a cubic millimeter in size. And so here what we're thinking of is the general procedure is to remove a damaged section of nerve, which they might be about a centimeter scale, expose to particular axons, somehow move the axons from the graft and the original still healthy tissue together. And this was a particularly interesting thing that I knew nothing about beforehand, that if you apply pulses of voltage to the membranes of two nerve cells that are touching, it can disrupt the membrane, and at least in a reasonable number of cases when the membrane can reform, and now you have a single connected cell that can actually still propagate electrical signals. And so that gives a functional axon again. So that's nice, but now if you're thinking of doing 1,000 of these in a relatively small volume, one of the problems with just this MEM scale technology is being able to figure out, well, which wires, if you like, should be the ones connected up. You don't want to connect a motor nerve to a sensor nerve and so on. And this is a nice opportunity to explore combinations of robots, if you like, at somewhat different scales. So the millimeter scale to the micron scale, that is the nano and MEMS as I label them here. Combined also, as I mentioned, with a much larger computer sitting outside this to figure out what all these devices should do. And I think it's important to think of these kind of applications where the physician really remains in the loop, making the broad overall decisions of what should go on. The lessons from this, which is a nice illustration of combining human high-level control with sort of micro devices and then also a nanoscale swarm of thousands of smaller robots, is you have a general strategy of using the small devices to look around and find out in detail what's going on. Then you use a much bigger computer as well as physician knowledge to decide what to do about it, incorporating whatever relevant clinical constraints you might have. And then finally use the devices, the small devices, as tiny hands to do what it is that you would want, because your hands as a person or even a MEM scale device are just too big. Looking at some simulations of this kind of behavior, you can get very fast and accurate treatments well within the time frame for which these injured nerve cells would die. So this would be a possible kind of application that could be done in an acute setting. You have some nerve trauma, and if let's say the paramedics can get you to the hospital fast enough and you would have these kind of devices, it could be done in a relatively short time. So we're talking, say, less than an hour, that reasonable physical properties of these devices should be able to go through this whole process and reconnect, hopefully, a reasonable fraction of these axons. Another nice thing about this is, unlike conventional surgery, these small devices, after the fact, can watch what happens. And so you could tell, did my repair work correctly as I hoped? Did something go wrong? You'd have a very detailed set of documentation for which you could use later on to improve the process. So those were two examples, and now I'd just like to wrap up with a couple more general comments. These kind of studies, because we don't yet have these devices to try out, it's quite difficult to validate them. So these are simulation studies using plausible physical properties of the devices we think it should be possible to build. But we don't really know a lot in detail about the biophysical parameters of all the microscopic environments these devices will be in. And so that certainly is a difficult challenge for this kind of work where we're trying to, ahead of time, understand what are the design capabilities of these devices. We get a partial answer for this just by looking at robustness. So if we vary the physical parameters over some orders of magnitude that seem plausible, both the device capabilities and the environments that they're in, to what extent will we still get the desirable behavior? But that's only a partial answer. A second general concern, of course, is safety when we're talking about medical applications. And so in one sense, we need to look at biocompatibility. If we just put the devices inside the body and they don't actually do anything, does that in itself cause any kind of reaction, at least over the time scale for which these devices will be operating, which might be minutes to hours and so on. And then we also need reliable controls that will handle errors, both in the devices themselves and things that we just don't know about the environment. There might be other bacteria in there, or just various different kinds of things going on that we don't know ahead of time. And so we need to allow for that. So for some further information on these particular tasks, I've listed a couple of places you can look here, and as well as my website. And I'd also like to point out, for any of you who are not familiar with the Nanomedicine book, that's really a great source of very detailed information about, if you like, how you might look at the body, body and medicine from the point of view of physics and computer science and nanotechnology robot design. So thank you very much.